welcome you all to the part 2 of Mechanical Injuries Important Questions of our FMTUT series. In part 1, we learned about few questions, but in this video, we are going to cover the remaining questions from mechanical injury. So, without wasting a single second, let's begin with this question. Now, we are moving towards bomb blast injuries and the mechanism of injury in bomb explosions. So, what are bomb explosion wounds? A bomb is a container filled with an explosive mixture and missiles, which is fired either by detonator or a fuse. Terrorist bombs often involve only 2 to 10 kgs of explosives. When an explosion occurs, the explosive material produces a large volume of gas and releases a large amount of energy. Pressure up to 1000 tons per square inch can be generated. A minimum pressure of about 700 kilopascals is necessary for tissue damage in humans. So how much pressure is required for tissue damage in humans? 700 kilopascals. But how much it generates? 1000 tons per inch square. A person can be injured by an explosion in a number of ways. So what are those ways? Number 1, disruptive effects. If the victim is almost in contact with a large bomb, he may be blown to pieces. Example, when the victim is carrying it. The pieces can be scattered over an area of 200-meter radius. Many parts of the body are never found, having been disrupted into tiny fragments and mixed with the masonry and other debris of the bomb site. A bomb exploding on the ground may cause severe damage or traumatic amputation of the lower legs. A bomb which explodes when the victim is bending over it may cause severe damage to arms, face, and front of the chest. When the victim is a few meters away or with smaller explosion, disruption is usually limited to mutilation of a localized area. So in case of disruptive effects, you just have to mention the distance of the person or victim from the bomb, the effects after the explosion, which is the scattering of human body into tiny fragments, and you just have to remember the fact that 7000 kilopascals is necessary for tissue damage in humans. So these are the disruptive effects. Disruptive means it disintegrates the body into many fragments. Second effect is burns. The temperature of the explosive gases can exceed 2000 degrees Celsius and the radiated heat can cause flash burns. It burns nearby objects and clothing. The flame causes extensive burns which involve irregular area of skin to a different degree. Tight clothing protects so that beneath collars, waistbands, socks and shoes and bras, the skin may be quite normal. So these are the points under the effects, or what do we say? The damage caused by the bomb. So there are how many types? There are in total we are going to learn about 6 types. 6 types of what? 6 types of effects of the explosion. Or say there are 6 ways in which a person can be injured by a bomb. So disruptive effects, we learned about them. What are disruptive? You can remember like this: disruptive, distance. So in disruptive effects, you have to write about the correlation between the distance of the victim with respect to bomb explosive site. Fine. Then what about burns? The temperature exceeds 2000 degrees Celsius and the heat may cause flash burns. Skin is completely burned, but the skin under your tight clothing is quite normal. That is the only thing. Number 3, air blast. An explosion produces a shock wave which spreads concentrically from the site of explosion at about the speed of sound. This wave of very high pressure is followed by a weak wave of negative pressure, a suction which lasts about 5 times as long. A shock wave exceeding 7000 kilopascals pressure is necessary to cause severe damage to the body. The shock wave can throw the victim against a wall or toss him through the air, causing blunt force injuries. The clothes may be blown off by the blasts. The clothing should be retained for the chemical analysis. The shock wave passes through the body. The homogeneous tissues like liver, muscles are not damaged. Homogeneous tissues like liver and muscle are not damaged, remember. Blast injuries of lungs is seen if the victim is within a few meters of explosion, and at such rate, the victim usually dies from other injuries. Lungs show subpleural patchy hemorrhages, scattered at random, often in line of ribs. Sectioning of lungs shows more discrete scattered areas of hemorrhage, often with a tendency to be more central than periphery. Microscopically, alveolar ruptures, thinning of alveolar septae, enlargement of alveolar spaces, and circumscribed subpleural, intraalveolar, and perivascular hemorrhages are the main findings. Desquamated alveolar and bronchial epithelium is seen lying free. This causes reactive pulmonary edema, and blood-stained froth is found in air passages and later bronchopneumonia. This specific pulmonary injury of air blast is called as blast lung. So what is given in air blast? Nothing, you just have to explain. Homogeneous organs like liver and muscles are not damaged that much. Second point, you have to write there are two types of waves, the outer wave and the inner wave. So the inner wave, okay, the inner wave, uh, uh, the the high pressure wave and the weak pressure wave. There are two waves, high pressure waves and the weak pressure waves. So the high pressure waves are followed by the weak pressure waves. Nothing. Second point. Third point, the shock wave passes through the body, obviously. Fourth point, there is huge damage to lungs. Now what are the damages they have described here, but remember the point. You can write in general, there are huge damages occurring to both the lungs of the body, and these damages cause reactive pulmonary edema, and blood stained froth is found in the air passages, and later bronchopneumonia is seen. So this specific pulmonary injury due to air blast is called as blast lung. The tympanic membrane most commonly ruptures with hemorrhage in the air. Damage to cochlea is more frequent. Subperitoneal hemorrhage and hemorrhages in mesentery and omentum vary in size, and laceration of abdominal organs may occur. Intracranial hemorrhage, contusion of the brain, injuries of the heart and aorta, pneumothorax, ruptured stomach and bowel may occur. Death may occur from the systemic air embolism, from air which enters the pulmonary veins after blast damage to the. So, see, in air blast, you have to describe 4 points only. Number 1, there are two types of waves, high pressure waves, weak pressure waves. Number 2, a body requires only 7000 kilopascals for the damage. Number 3, homogeneous organs like your lungs and muscles are not quite damaged. Number 4 point, lungs are severely damaged, which causes bronchopneumonia, then blood stains in air passages, then bloody froth, then your what do we say, edema, pulmonary edema, so the bronchopneumonia. So these injuries are nothing but blast lung injuries. Number 5th point is subperitoneal hemorrhage and hemorrhages in mesentery and omentum. These are also seen. So write about everything. Death may occur from systemic air embolism, from air which enters the pulmonary veins after blast damage to the lungs. When the explosion is in water, the pressure changes are called as underwater blast. The physical changes are similar to those of the explosion in air. Injuries occur mostly in GI tract and less commonly in lungs. So whenever the person is underwater, the injuries are caused in GIT rather than lungs. Most of the lung injury is due to pressure transmitted from abdomen through the diaphragm. Solid blast refers to a wave of energy that spreads through a rigid structure when an explosion is detonated near it, and people in contact with that structure can be injured. So what is solid? See, three types of blast we learned. Number 1, blast lung. Number 2, underwater blast. And number 3, solid blast. Everything is in the name. Now, number 1, blast lung. What did we learn? The injuries caused by the air blast to lungs, such as bronchopneumonia, edema, pneumothorax, blood froth, blood in air passages, everything, subpleural damage, everything is called as blast lung. Number 2, underwater blast. Injuries occurred to the injuries when the explosion is in the water. The pressure changes are called as underwater blast. Simple. And what about solid blast? It refers to a wave of energy that spreads through a rigid structure when an explosion is detonated near it, and people in contact with the structure can be injured. So steel construction of tank and warships conduct shock wave well and cause solid blast injury. The injuries are mostly skeletal. The fractures depend on the position of the person. Fractures of legs and vertebral column are more common. Gastrointestinal damage is more common from the lung damage. See, so GI damage is more common than the lung damage. In some cases, death may occur without any external injury. So these are the points. Fourth point, flying missiles. The blast may drive multiple fragments of bomb or pieces of nearby objects, example gravel, grass, glass, wood, brick, plaster, etc., through the air into the skin and cause bruises, abrasions, puncture, lacerations intimately mixed on the skin. This triad of injury is diagnostic. Most of the bruises and abrasions are less than 1 centimeter in diameter, although they tend to unite. The puncture lacerations are also usually of this size. They are racked, sometimes with solid margins, and may contain foreign material, such as scrapes of clothing, wood, or metal. The skin can be darkened by an explosion which drives dust into the skin and causes fairly uniform tattooing. The force of the bomb explosion is extremely directional, and the pattern of the injury might indicate that the person was carrying the bomb or bending over it or sitting to one side of it. So under this point of flying missiles, remember, they told flying missiles. Flying missiles means obviously the everything which is going to fly would be acting as missile on the body of the victim. Now, what do I mean by this? See, everything means your gravel, glass, wood, brick, plaster, everything is going to fly because of the immense pressure of the bomb. So what will happen? Those things are also going to cause harm to the patient, harm to the victim, or say injury to the victim. Now, what are the injuries? Bruises, abrasions, puncture lacerations, and your everything, and mixture of these injuries. So this triad of injury is diagnostic. Okay. So in this point, you have to remember, you just number one point, what we'll be writing, everything which everything means your gravel, glass, wood, brick, plaster would act as flying missile because of the immense pressure of the bomb. Number 2 point, the injuries which are going to be caused by these pieces would be bruises, abrasions, and puncture lacerations, or mixture of the three. Number third point, what would be the third point? The skin can be darkened by an explosion which drives dust into the skin and causes fairly uniform tattooing. So tattooing appearance would be there. Number fourth, the margins of the injury are soiled and may contain foreign material. Number fifth point, the force of the bomb explosion is extremely directional. Directional word is very important, and the pattern of the injury might indicate that the person was carrying the bomb or bending over it or sitting to one side of it. So sixth point, either the person was carrying the bomb, either he was bending over it or sitting to one side of it. This was about your flying missiles. So what were the 4 points we learned till now? Disruptive effects. Number 2, burns. Then number 3 was, what was number 3? Air blast. Yes, in air blast we'll be writing about blast lung, underwater blast, and solid blast. And fourth point is now your flying missiles. Coming to fifth, falling masonry. When a building is destroyed by a bomb blast, the person inside sustain multiple injuries and die of traumatic asphyxia. Death may be caused due to burns, blunt force injuries, falling debris, and rarely from systemic embolism. So falling masonry is anything which falls due to your bomb explosion, like building or say anything. So when a building is destroyed, obviously there is going to be multiple injuries and traumatic asphyxia to the victims. What about fumes? Sixth point, if a bomb explodes in a confined space, enough CO is produced to cause asphyxia. In a victim of bomb death, X-rays of tissues should be taken as pieces of metal, especially the detonating mechanism may be seen. So these were the 6 points under the types of bomb explosion, or say mechanism of injury in bomb explosions. So what is the what are the number of ways in which a person can be injured by an explosion? Disruptive ways, number 2, burns, air blast, flying missiles, falling masonry, and sixth is your fumes. Coming to next question, section 44 IPC, define mechanical injuries, classify them, what are stab wounds, medical legal importance, and what are contusions. So very first thing, define injury first. An injury is any harm whatever illegally caused to any person in body, mind, reputation, or property is called as an injury. See, injury is not technically your related to your body. It is also the one which, it also causes harm not just to body but to mind, reputation, or property. Remember the 4 words: body, we all know body, then mind, reputation, and your property. So it is any harm and it is illegal caused to any person. Medically, a wound or injury is a break of the natural continuity of any of the tissues of the living body. Mechanical injury or wounds are injuries produced by a physical violence. That is why they are called as mechanical. Trauma is an injury inflicted by force on a living tissue. So these are the certain differences between common terms like injury, mechanical injuries, and trauma. What about mechanical or physical injuries? Due to blunt force, then due to sharp force, and your firearms. So very important thing is, mechanical injuries are categorized into 3 parts. Number 1, due to blunt force, number 2, due to sharp force, and number 3, firearms. So due to blunt force, we have abrasions, contusions, and lacerations, and fractures and dislocations. Fine. So there are 4 types under blunt force: abrasions, contusions, lacerations, and fractures and dislocation. What would be there under your sharp force? Incised wounds and chop wounds. Incised wounds, chop wounds, and stab wounds. Incise, chop, and stab. And under firearms, firearm wounds and blast injuries. So these are the types of mechanical injuries. And what are mechanical injuries? The injuries produced by a physical violence. So starting with a very first thing, due to blunt force. what is caused due to blunt force? Revise with me. How many forces are there? How do we differentiate mechanical injuries? In three main types: due to blunt force, sharp force, and firearm. Under blunt force, we have four subtypes: abrasions, contusions, lacerations, and your bone fractures. Under your sharp, we have two types. Incised, we have three types: incised wound, we have stab wound, and we have chop wound. And under your firearms, you have two things: firearm wounds and blast injuries. So coming to very first point, that is abrasion. Abrasion is also called as grazes or scratches. It is defined as a superficial injury on superficial layers of epithelium or on the mucous membrane caused by a hard, blunt and rough object in one of the following ways: either by fall, by blow, by being dragged during vehicular accidents, by teeth bite, by ropes and strings tied around the body parts, scratching with a sharp pointed object. So these are the ways in which abrasion can be done. Examples of hard and blunt objects are bamboo stick, wooden stick, iron rod, hammer, cycle cell, items of furniture, stone, bricks, shoe, feast, hand, foot, paperweight, cricket ball, handles of weapons, and blunt edges. So what are the examples of hard and blunt objects? Bamboo stick, wooden stick, iron rod, hammer, cycle chain, and yeah, we all know the examples of hard and blunt object. What are the examples of hard, blunt, and rough objects? Rough surface, then rough stick, cycle chain, stone break, rough handle. So these are the examples of. Starting with classification or types of abrasion. But before that, I want your people to understand. See, abrasion is classified into two types according to the force: caused by tangential force or caused by perpendicular force. So two forces are there: tangential force and perpendicular force. Under tangential force, you will have two things: scratch abrasion and graze abrasion. And under perpendicular force, you will be having three things: pressure abrasion, impact abrasion, and patterned abrasion. Talking about scratch abrasion under tangential force, it is a type of abrasion which is caused due to pin, fingernails, and thorn. Any injury caused due to pin, fingernails, and thorn. It is quite easy. Any injury caused due to scratching is called as scratch abrasion. And what are those weapons? Pin, fingernails, and thorns. What about graze abrasion? Very common abrasion because it is caused due to friction between skin and rough surface. So multiple scratches are there over a wide area. And what are the other names? Gravel rash, brush burn, sliding abrasion, and friction burn. Number third point regarding graze abrasion is it has got head and tail also. Head is deep and tail is superficial. Number fourth point, it helps us to identify the direction of force. And there is hipping of epithelium. What do I mean by hipping of epithelium? Hipping of epithelium means it is same way like piling of coins. Okay, we all know piling up of coins. One coin over the other, then another coin over the third one. Fine. So that is called as piling up of coins. In same way, collection of epithelium at one spot, particularly at the tail of the injury, is called as your hipping of epithelium. I don't have picture here, but I want you people to see the image of gravel abrasion. Then you'll be able to understand the head, tail, and epithelial tag. That is nothing but hipping of epithelium. Fine. So hipping of epithelium tells us the direction of force. These were the points regarding scratch abrasion and graze abrasion, which comes under the tangential force of abrasion. Coming to second type, perpendicular force. Perpendicular force causes the crushing of epithelium, obviously. See, logical fact it is, tangential force is going to cause scraping off of epithelium, and your perpendicular force is going to cause crushing of epithelium. So under crushing, we have three things: pressure abrasion, impact abrasion, and patterned abrasion. So coming to pressure abrasion, it is a type of abrasion in which force is very less. Okay, force is very less, but the duration is very high. For example, say shoe bite. In shoe bite, the force is very minimal. That's why we are able to walk. But after sometimes we tend to keep that shoe or say anything in our leg for more hours or more duration. So that leads to shoe bite. Duration leads to shoe bite, not the force. So always remember, pressure abrasion is caused due to continuous small amount of force for a long time. That is nothing but your pressure abrasion. Number 2, impact abrasion. Now impact abrasion is also called as imprint abrasion. Remember, I for impact, I for imprint. So now it is completely opposite of pressure abrasion. What I told you on pressure कि force is very कम, force बहुत कम होता है और duration is very long, मतलब time बहुत लगता है. That is nothing but your pressure abrasion. But what happens in impact and imprint abrasion? The force is very much. Now the force is very much and the duration is very less. That is called as impact. See, I'll give you a trick to remember. In impact abrasion, or just relate it with our general lives. If you want to make your impact in the society or in the world, what do? You increase your aura. Fine. And how you increase your aura? By, doing hard work, or say anything, doing smart work also, and sacrificing your anything for sacrifices count also. So to make your impact in society, what you people do, you increase your aura first. And to increase that aura, you have to practice a lot, you have to work hard, you have to give your everything in that one thing to increase your aura. That makes you to grind every time and every second. So what you're doing, technically you're applying a large amount of your will. Fine. And what is that will? That is nothing but your force. So in impact abrasion, just one thing should click to your mind whenever and wherever you hear this word impact abrasion. Impact means I want to create an impact in this whole society or world, let's say. So what I'll do, I'll make everything, I'll just do everything whatever possible to make my impact on the entire universe. So that is nothing but, for that purpose I have to increase my push, I have to increase my force. So in this way, I hope you people got that. So in case of impact or imprint abrasion, you have to increase the force for less duration. Remember, force and duration are completely indirectly proportional. Whenever you increase the force, you have to decrease the duration. In that way, you can remember. But in pressure abrasion, there is decrease in force and increase duration. And in impact abrasion, you have got increase in force and decrease in duration. So that is nothing but your impact abrasion. Now, what are the examples? Tire mark. Obviously, the weight of that the vehicle is so high that even if even if it rests on the particular human for 2 minutes, then it's quite okay to kill that person. Fine. So that is nothing but tire mark or radiator mark, grill mark. So these are nothing but your impact abrasions. Remember, increase in force, decrease in duration. Why? Because I want to create an impact, I want to create my pattern abrasion. In this, you'll find a pattern of weapon abrasion. You'll be able to find out which weapon has been used. So how you're going to remember the difference between impact abrasion and your pattern abrasion? See, whenever there is no mention of force and duration, and there is just information regarding the pattern of weapon, or the question says this pattern is observed, so identify the abrasion, then that would be pattern abrasion. But when there would be mentioning of force and duration especially, then that would be impact or pressure abrasion according to the force and duration. Fine. So these were the types of abrasions. Again, I am revising. Abrasions are divided into two parts: tangential force and perpendicular force. Tangential force causes scraping off of epithelium, and perpendicular force causes crushing of epithelium. Under tangential force, we have got two types: scratch abrasion with pin, fingernails and thorn, and graze abrasion because of friction between skin and the rough wall or rough surface. So what are the other names of graze? Gravel rash, brush burn, sliding abrasion and friction burn. Coming to another type, perpendicular force, we have got three subtypes. Pressure abrasion, whenever there is decreased force and increased duration. Example, shoe bite. Number 2, impact abrasion. I want to create an impact on the whole world, so by increase in force for less duration. Okay. Third is pattern abrasion, because in this abrasion I am going to see the pattern of the weapon. Example, imprint of bicycle chain, or say spirals of the electric wires, etc. So these were the types of abrasion. I hope you people understood. It is not given here, but I want you people to create a flowchart in exam and mentioning about the tangential force and perpendicular force and their subtypes. Moving ahead, what are contusions? Contusion is also called as bruise. I want to tell you one thing. See, whenever there is injury, or say scratch or scar, whenever there is injury to the epidermis, then that is called as abrasion. Whenever the injury occurs in dermis, so there is blood collection in dermis, then that is called as bruise or contusion. So abrasion and contusions are two-dimensional injuries, remember. Okay, these two are only the two-dimensional injuries, abrasion and contusions. So moving ahead with the definition, contusion is defined as an injury present subcutaneously or under the mucous membrane with epithelium being intact. See, epithelium is intact here, but in abrasion epithelium was damaged, and is caused by the impact of hard and blunt object, leading to rupture of capillaries subcutaneously and therefore extravasation of blood. Fine. A contusion may be present on the external surface of the body or on the internal viscera and can be caused in one of the following ways: either by blow of hard and blunt object, fall, hitting a hard and blunt object, pressure and compression of the body parts, violent muscular activity like convulsions, violent coughing during sucking with teeth. So these are the examples or ways in which a bruise is caused. Now, what are the characteristics of a contusion? Contusion is a subcutaneous injury, basically injury to dermis, okay, involving rupture of capillaries and tear of subcutaneous tissue. Overlying epithelium is intact. It is usually caused by hard and blunt object, may be present on external surface of the body or on the internal viscera known as ecchymosis. So whenever the bruise or contusion occurs inside or say in internal viscera, that is called as ecchymosis. Whenever it is outside, it is called as either bruise or contusion depending upon the location. Then in a living, it is tender discolored swelling, okay, may be associated with abrasion known as contused abrasion, abraded contusion, or with laceration known as CLW, that is contused lacerated wound. So what they are trying to say, contusion can be present with your abrasion also or laceration also. Whenever that is present with laceration, then that is called as contused lacerated wound. If present with abrasion, abraded contusion, okay. Coming to next point, may be associated with injury is usually round in shape, and yeah, injury is usually round in shape, though at times it may be of the shape of the object, which is called as patent bruise. So one thing you have to remember, whenever there is damage to the subcutaneous tissue or dermis of the skin, then that is called as bruise. But whenever the damage occurs in viscera, that is called as contusion or ecchymosis, okay. So whenever skin comes in mentioning, then that is bruise, and if viscera comes, contusion. Injury is usually round in shape, though at times it may be of the shape of the object, which is called as patent bruise. Size of the injury may vary from pinpoint hemorrhages to large hematomas like extradural or subdural hematoma. Size of the injury is always more than the impacting surface of the object due to continuous oozing. Site of the bruise may be the site of impact or away from the site due to gravity shifting of blood, and that is called as ectopic bruise. So we are going to study the types of bruises. A contusion may not be seen in dark individual. A deep contusion may not be visible externally. A deep contusion may become visible externally after 1 to 3 days. A deep contusion may become visible externally only after death, and that phenomenon is called as Spilsbury phenomenon. After death, circulation ceases, but due to stagnation and hemolysis, the blood pigments diffuse locally to the external surface, and that is why we are able to see that. So that is nothing but Spilsbury phenomenon. Contusion heals in 1 to 2 weeks. Healing is without apparent scarring, though at times there may be internal scarring, but apparently it is without scarring. Now, what are the types of contusion? Superficial, deep, and patent. Factors influencing a contusion: age. Bruising is better and easier in child and elderly. Sex, bruising more and easy in females because of more fat and less muscles. Complexion, contusion is seen better in fair people. Pathological conditions, contusions are more and better in one suffering from malnutrition, rickets, atherosclerosis, hypertension, hemophilia, leukemia, and purpurias. Chronic alcoholics, bruising better because less muscle mass and cutaneous vasodilatation. Amount of force is directly proportional to the amount of bruise. Type of object, bruising is better with hard object, may not appear with soft objects like clothes, sandbag, etc. Effect of gravity, due to gravity the discoloration may appear away from the site of impact. Example, black eye may be seen, but injury is to your anterior cranial fossa. So that is example of ectopic bruise. Then swelling of neck may be seen in fracture of mandible. Swelling of thigh may be seen in fracture of pelvis. Swelling of knee may be seen in fracture of femur. Swelling of ankle may be seen in injury to leg. Vascularity of the part, it is directly proportional. More vascular the part, more would be the contusion. Site of body, contusion is better on parts overlying bone. Example, forehead, eyebrows, malar prominence, elbow, iliac crest, perineum, knee, and shin. Shin of what? Shin of tibia. Contusion occurs easily on soft and vascular body parts like face, breasts, vulva, and scrotum. Contusion appears with difficulty on abdomen and buttocks because both retract on impact. Usually no contusion occurs on hard and tough body parts like palms and soles. Usually surface contusion does not appear on heavily clothed body parts, though at times a deep contusion may result. So these are the factors which influence contusion. Age of contusion, how we are going to determine? Age of contusion is determined from color changes in the contusion as a part of healing. due to hemolysis of RBCs and changes in hemoglobin. So initially it is red due to oxyhemoglobin. After 1 to 2 days it turns blue due to reduced HB. After 2 to 3 days it turns bluish black or brown due to hemosiderin. And after 4 to 7 days it turns green due to hematoidin. And after 7 to 10 days it turns yellow due to bilirubin. After 10 to 14 days, normal skin due to absorption of pigments. So it requires 14 days, 2 weeks to heal. Contusion requires 2 weeks to heal. Subconjunctival hemorrhages are initially red, then yellow, and finally disappear. So remember example of subconjunctival hemorrhages: red, yellow, and then disappear. Only 2 colors. Now, what is the difference between ante-mortem contusion and post-mortem contusion? We'll talk about ante-mortem contusion first, that is before death. Swelling is usually present, size is more, color changes as per stage of healing seen, color not uniform, pale at center, margins may be abraded or lacerated, margins diffuse into surroundings, features of inflammation and vital reactions are seen, blood cannot be easily washed away. On microscopic examination, infiltration of surrounding tissues with blood cells are seen and enzyme levels are raised. So in ante-mortem contusion, obviously you are just imagine a contusion and you're going to see swelling, then size would be more, color changes would be there, color would not be uniform, the margins would be either abraded or say lacerated, then the features of inflammation and vital reactions are seen because the person is living, right? Blood cannot be easily washed away due to clotting, then or localized collection of blood. And on microscopic examination, infiltration of surrounding tissues with blood cells are seen. So these are the basic points. You just have to imagine a contusion in living person and then you have to write. But what will happen in dead person? See, there would be no swelling because the person is already dead. Then the size would be less with the same amount of force. Then there would be no color changes. Then uniform color would be there. Then margins would not be abraded or lacerated. Then there would be clear cut. Okay, in vital reactions would be absent, then it can be easily washed, and there would be no infiltration of surrounding tissues and no enzyme levels are raised because the person is dead. So everything opposite to living person is you have to write in post-mortem contusion. What is the differential diagnosis? Post-mortem lividity and chemical burns. So these two are the differential diagnosis. What do I mean by differential diagnosis? In simple words, you can understand the same features are seen in PM lividity. So you tend to get confused whether it is PM lividity or contusion. So you have to differentiate both the diagnosis. See, PM lividity and contusion both are the two different diagnoses. So now you have to make a difference between those two, whether it is PM lividity or whether it is your contusion. That is known as differential diagnosis. I have to differentiate between the two diagnoses which are in front of me. Either it is PM lividity or your contusion. Now we have to write about the differences. Very important question it is. So we'll learn about chemical burns afterwards, but understand the difference. We'll be learning about contusion first. Contusion may be antemortem or postmortem. It is due to the rupture of capillaries and therefore extravasation of blood. It is subepidermal in dermis, may be present anywhere on the body, no effect of pressing the area with thumb. On incising the discolored part, bloody area seen due to extravasated blood. Swelling is usually present, size is more, color changes as per stage of healing seen, color is not uniform, it is pale at the center, margins may be abraded or lacerated, margins diffuse into surroundings, features of vital reactions are seen, blood cannot be easily washed away, and infiltration of surrounding tissues with blood cells are seen, then enzyme levels are raised. And now what is medical legal importance? It helps us to know about the nature of injury, type of weapon, and age of injury. So everything you have to write in your contusion. I hope you people understood. I'm not explaining it again. Just you read it once and you'll get the points. Now coming to PM lividity. See, PM lividity is always post-mortem. That is why it is called as post-mortem lividity. Number 2, it is due to stagnation of blood in toneless dilated capillaries. What do I mean by stagnation? Collection of blood in toneless. Why toneless? Because the person is died. That is why the capillaries have got no toneless capillaries. Number 3, it is epidermal. Number 4, it is only on the dependent body parts, not everywhere. 5th, blanching is seen if the PM lividity is not fixed. What do I mean by blanching? Blanching means for some time it is going to appear as whitish. Then blanching is seen if PM lividity is not fixed. What do I mean by blanching? Whenever you apply a pressure on the area of PM lividity, then there is temporary paleness of that area. Why? Because the blood which is present inside the toneless capillaries, that is going to be pushed away. That is why we see whitish part, temporary paleness. That is nothing but your blanching. Sixth, few oozing points seen due to cutting of capillaries. Then there is no swelling. Then there is less amount of force. With less amount of force also you are going to see PM lividity, and no color changes, uniform color. Then margins are not usually not abraded or lacerated. Then margins are clear cut. Margins do not diffuse into the surroundings. Then vital reaction is absent because the person is died, and blood can be easily washed away. Okay, blood cannot and blood can be easily washed away, and there is no infiltration of the cells. Okay, what do we need to know? PM lividity helps us to know the time since death, position of the dead body, and whether dead body was shifted. So these are the 17 points regarding PM lividity and contusion. I hope you people understood the difference. First write about contusion, everything about contusion, and then write everything opposite in PM lividity. So that is going to help. Just remember blanching point in PM lividity. What about chemical burns? I told you there are two differential diagnoses for contusions. First is your PM lividity, second is your chemical burns. So chemical burns may be caused by strong acids, strong alkalis, iodine, bromine, marking nut juice or calotropis juice. Characteristics: no vesication, no red line of demarcation, no swelling, no rupture of capillaries, and so no extravasation of blood, no color changes as in contusion, marks of trickling are present, margins are clear cut, injury is irregular, discoloration depending upon the chemical. Chemical can be detected on chemical analysis. Chemical burns usually also present on fingertips and under the nails due to scratching. So scar formed is keloid in type. So these are the 12 features of chemical burns. Remember, chemical burns are not just caused due to acids but stronger alkalis also, iodine, bromine, and your marking nut juice and calotropis juice. So there is no vesication, no red line of demarcation, no swelling, nothing. Only scar formed is of keloid type. Now what are the medical legal aspects of contusion? Contusions are usually accidental, sometimes homicidal, and rarely suicidal. A large of the multiple contusions may lead to death due to shock or extensive hemorrhage. Even a minor contusion on brain, pons, or vasomotor center and heart, etc. may prove fatal. Contusion of a part may later result in gangrene. From a contusion, we can know nature of injury, nature of weapon, age of injury, whether it was ante-mortem or post-mortem, whether suicidal, homicidal, or accidental. Sometimes chance of internal injury is also present, and sometimes purpose of injury can also be found out. Sixth, medico-legally, abrasion is more important than a contusion because, see, this point is very important. Why abrasion is more important than contusion? Because a contusion may not be seen in dark individuals, may not be seen externally, may appear after 1 to 3 days, may appear only after death, is usually round, is usually larger than the impacting surface, may be present away from the site of impact, which is our ectopic bruise or contusion, and direction of injury cannot be known. So because of these points, abrasion is more medico-legally important than contusion. Coming to third type, laceration. Laceration is also called as tear. Laceration is defined as the injury caused by heavy, hard and blunt object. Remember, it is caused by blunt object, heavy, hard and blunt, involving damage to some deeper layers and deeper body parts like dermis, muscles, bones and internal viscera. Fractures and dislocations are included in lacerations. A laceration may be caused in one of the following ways. Number 1. Violent blow with heavy, hard and blunt object. Violent fall, especially on projecting the object. Being run over during vehicular accidents, railway accidents, machinery accidents. Being caught in moving belts. By the hooves, horns or teeth of animals. By blunt edged weapons, example metal sheets and broken bottles. So these are the ways in which one can find out the laceration. Now what are the types of laceration? Split laceration, stretch laceration, avulsions, tears and cut laceration. There are 5 types: split, stretch, avulsions, tears and cut laceration. Talking about fourth type, what are incised wounds? Now you are going to tell me incised wounds come under the sharp object, fine. So talking about incised wounds, cut, slash or slice. Definition: incised wounds are defined as the injuries caused by sharp-edged object when the weapon is struck or braced and drawn across the body part. That is, there is pressure and friction. So, pressure is also there, friction is also there. Examples of sharp-edged objects: blade, razor, scalpel, knife, sickle, axe, kukri, sword, dagger, chopper, cleaver, and shovel, etc. What are the types? Incised wounds and chop wounds. Now, what are stab wounds? These are also called as puncture wounds. A stab wound or puncture is defined as an injury caused by a sharp pointed weapon or object when the sharp tip is thrust into the body part. So, stab wound can result even if the point is blunt, example by horn of a bull or end of an iron rod. Examples of sharp pointed weapons are knife, dagger, gupti, whatever it is called, sword, ice pick, spear, arrow, and bayonet, etc. Now, what are the types of stab wounds? Even stab wounds have got types: puncture wound, penetrating wound, perforating wound, and concealed punctured wound. 4 types. What is puncture wound? Any wound where depth is the greatest dimension and it is caused by sharp pointed object, it is puncture wound. What is penetrating? Whenever the sharp point of the object penetrates into one of the 3 body cavities, it is penetrating wound. Perforating: if the sharp tip of the weapon perforates the part through and through so as to cause a wound of entry and wound of exit. So whenever there is wound of entry and exit, then that is perforating wound. It is labeled as perforating wound. Concealed puncture wound: a puncture wound which is concealed or hidden. Punctures may be punctures by thin and sharp pointed object like pin, needle, nail, ice pick, etc. In the fontanelle, inner canthus of eye, under upper eyelid, ears, up the nose, down the throat, in folds of neck or axilla, under the breast, in umbilicus, urethra, vagina, or rectum. So these are the examples of hidden puncture wound. They are not easily seen on examination and they are almost always homicidal. Now, what are the characteristics of swab wound? Stab wound have got general characteristics. Most important characteristic is the depth. Okay, depth is the greatest dimension and it is caused by sharp pointed object. Wound results when the sharp tip is thrust into the body part, and wound of entry and wound of exit may be caused. Number 2, size. The length of the wound of entry is slightly less than the width of the blade because of the elastic recoil of skin. Okay. So length of the wound of entry is usually larger than the length of the wound of exit because of tapering tip. Either there would be tapering tip or recoil of skin. So length of wound of entry may be equal to the length of wound of exit if the whole of the long blade is thrust in. So in 3 conditions you have to understand. Length of the wound is slightly less than the blade because of the elastic recoil. Okay, length of the wound of entry is usually larger because of tapering tip. So it depends on the manner of stabbing, and length is equal whenever there is whenever the whole long blade is thrust in. Wound of entry may be larger than the width of blade if the weapon is moved while in the body, if the victim moves after the weapon is thrust in. So width of the wound depends upon the thickness of weapon. Usually gaping is present. Okay. Shape, we learnt about the size, we learnt about the general characteristic, size. Now we are going to learn about the shape. Shape of wound of entry depends upon the nature of blade. If the blade is with thin, single sharp edge, injury is wedge shaped. If the object is double sharp edged, then the injury is elliptical. Obviously, imagine, okay, if there is single sharp edge, then that is going to be triangular only. If the object is double sharp edge, then that is going to be elliptical. If the object is circular, injury is circular. If the object is squarish, injury is cruciate. What about margins in surrounding skin? Margins are inverted at the wound of entry and everted at the wound of exit. We all know. Margins are clear and clean cut because of sharp edge and are ragged in case of blunt edge. Margins become lacerated if weapon is thrust up to the hilt. It produces a hilt mark, hilt injury, as abrasion, contusion, laceration or on the wound of entry. Hilt mark is very important. Edges of the weapon are blunt and surrounding skin is usually clear. Now it also talks about the direction. Direction of assault can be known by combining the wound of entry and exit. In case after partial withdrawal, the weapon is rethrust, multiple tracks of injury may be caused. Depth. Depth of the injury depends upon sharpness of the tip, sharpness of the edges, length of the blade, amount of force used, body part struck, whether the part struck is clothed or not. So many factors are there. On abdomen, the depth of injury is always more than the length of the penetrated blade because of retraction of abdomen. In a living, a stab wound should not be probed to know its depth as it may lead to dislodging the clot and therefore fresh bleeding may occur. So what they are trying to say is stab wound should not be probed to know its depth. There should be no, there should be no attempt of knowing the depth of the injury, because it may lead to fresh bleeding in living person. Depth of the wound in a living can be known by injecting a radio-opaque dye and radiographing the injury or on the operation table. Miscellaneous, a piece of the cloth may be present in the wound of entry. The commonest cause of death is injury to internal viscera, and healing is usually by scarring. So these were the points regarding your stab wound. Fine. Puncture wound, penetrating wound, perforating wound, and concealed or hidden wound. Talking about the medical legal importance of stab wound. The shape of the wound may indicate the class and type of weapon which may have caused the injury. Number 2, the depth of the wound will indicate the force of penetration. Number 3, direction and dimensions of the wound indicate the relative position of the assailant and the victim. 4th, the age of injury can be determined. 5th, position, number and direction of wounds may indicate manner of production, that is suicide, accident or homicide. Then 6th, if a broken fragment of weapon is found, it will identify the weapon or will connect an accused person with the crime. So these were the points of medical legal importance in case of stab wounds. Coming to last question of today's session. Entry wound of revolver in a victim. What are the specific features at different ranges? So range of firing and firearm injuries. Range of firing can be classified as contact firing, close range firing, and long range. Contact firing, muzzle end is in contact with the body part. Firing up to 8 cm leads to point blank range of the firing. Close range firing, firing up to 2 yards, 6 feet. Some label firing up to 1 yard as near range firing and 1 to 2 yards as close range firing. So in close range, we are going to fire up to 2 yards or 6 feet. And what is long range firing? Firing from beyond 2 yards, more than 6 feet. Okay. Talking about contact firing. Muzzle end is in contact with the body part. It is common in suicidal firing. Missiles may produce wound of entry and wound of exit. Missile and its associates enter en masse. Gases accumulate in the body part and lead to bursting or multilesion. Obviously, imagine if a muzzle end is in contact with brain or skull or say any body part, then due to the expulsion of gases, there would be bursting of lead. Now, what are the features of wound of entry? Wounds are similar in case of shotgun, rifled, bolt gun. So wound is single and larger than the diameter of the missile, and wound of exit due to bursting of that part. Shape is cruciate, cruciform or stellate. Margins are everted. Why everted? Because of bursting. Due to back pressure of gases, margins are ragged. Cranium and abdomen may burst open. Marking of the muzzle end may be present on the body part. Missile and its associates enter en masse. Due to flame, the track of injury is burnt. Due to gases, there is increased carboxyhemoglobin level, therefore injury is cherry red in color. Remember, injury is always and always cherry red. Why? Because of gases, there is increased carboxyhemoglobin level. Gunpowder particles present inside the wound. So these were the points regarding your wound of entry. Few more points. Wads may be present inside the wound. A piece of cloth may be present inside the wound. Due to negative pressure, cloth, hair, tissue or blood may enter the muzzle end, and that is known as back spatter. This is important Viva question. What is back spatter? Due to the negative pressure, cloth, hair, tissue or blood may enter the muzzle end. If the contact with skin is loose, gases released, settle nearby, producing circular zone called as corona. So what is corona? If there is the contact is loose, then the released gases are going to settle nearby, and that layer is called as corona. So these were the points regarding wound of entry in contact firing. Now we are going to learn close range firing. Features. Injury is usually circular, may be oval or elongated in case of firing at an angle, and also the part closer to the body is broader. Size of wound of entry is smaller than the diameter of the missile because of elastic recoil of the skin. Size of wound of entry is smaller than the wound of exit because of rarely two may be equal. We all know because of recoil of skin. Margins are inverted. There are 3 collars. Up to a certain distance, there are injuries due to associates of missile. Bleeding is relatively less. There are increased carboxyhemoglobin levels. Therefore, the color is cherry red here also, in close range also, and in contact also. Swelling is present. Homogenization of derm and collagen occurs. Piece of cloth, mud or paint may be present. Up to 2 yards, that is 6 feet. The appearance of the injury is similar in rifled bored weapons and shotgun. All the pellets enter en masse. In shotgun, at 2 yards, markings of the pellets are seen at the periphery of the main wound. Okay, so in shotgun, you are going to find out the small lead pellets all over the wound, but in close or say rifled weapon, you are not going to find those pellets. 15th, in a shotgun at 3 to 8 yards, besides the main wound of entry, there are injuries due to other pellets over an area of 3 to 8 inches. So in this image it is shown at 3 to 8 yards. So at 2 yards it is like this, at 3 to 8 yards and greater than 8 yards. Beyond 8 yards, multiple wounds of entry are seen due to individual pellets. What is long range firing? Firing beyond 2 yards. Wound of entry. With bullet, wound of entry is single and is characterized by the presence of 3 collars and actual wound of entry. So 3 collars are there and actual wound of entry is also there. Bullet may wobble, tumble or yawn and produce bizarre wound. There are no injuries due to associates of missile because it is obviously long range firing. That is why there is no associate missiles injuries. And yes, we have completed our mechanical injuries chapter. We have completed the remaining questions. I hope you people understood. I want you people to revise mechanical injuries from the textbook also and just go through the images and the types. So we are good to go for next video. And yeah, I hope you people understood. Until then, keep learning, keep growing. Bye.